ग्लोबल मेडिकल टेक्नोलॉजी कंपनी स्ट्राइकर और मैक्स स्मार्ट सुपर स्पेशलिटी हॉस्पिटल साकेत ने भारत में रोबोटिक आर्म असिस्टेड जॉइंट रिप्लेसमेंट को बढ़ावा देने के लिए रणनीतिक साझेदारी की घोषणा की है। इस पहल के तहत मैक्स साकेत को ओनर्थोपेडिक्स के लिए ट्रेनिंग एंड एजुकेशन सेंटर बनाया जाएगा, जहां सर्जनों को एडवांस रोबोटिक जॉइंट रिप्लेसमेंट की ट्रेनिंग दी जाएगी। मैक्स हेल्थ केयर के चेयरमैन अभय सोई ने कहा कि यह साझेदारी भविष्य की हेल्थ केयर जरूरतों को मजबूत करेगी। वहीं डॉक्टर रमणीक महाजन ने इसे मरीजों के बेहतर और सटीक इलाज की दिशा में बड़ा कदम बताया। स्ट्राइकर ने कहा कि यह पहल भारत में रोबोटिक जॉइंट रिप्लेसमेंट को अधिक सुलभ और प्रभावी बनाने में मदद करेगी।
Is delivered at scale. And that is also applies to the field of orthopedics. And if you think about orthopedics, the burden of disease is high, access to advanced treatment is expanding, and at the same time, this market in India is rapidly evolving. Governments are accelerating their investments, hospitals are expanding capability, infrastructure, and industry is investing in talent and innovation, and certainly healthcare professionals are adopting new technologies much faster than ever before. And when I think about orthopedics, there's estimated 6 lakh joint replacements taking place every year, the procedures taking place. And most of those procedures are done conventionally. However, there is a rapid surgence in advanced technologies. Robotic assisted surgery is on the rise, with now roughly about 10% of those procedures using this technology. And if you think about joint replacements, the demand is ever increasing. But in India, often patients present with complexity, they present late, and often they're presenting and it's under index versus the population. So there's much more that we could do. Robotic assisted surgery offers a great advantage and a significant impact both for the surgeon, the hospital, and for the patient. It can provide more enhanced personalized surgery. It provides data-driven insights for the surgeon, which leads to better outcomes and obviously more than consistency in care. At Stryker, we like to support with the leading hospitals globally when it comes to training. And we invest in surgeon training, supporting their skills, their confidence, their capability, so that they can then deploy these techniques at scale.
The clinicians and healthcare professionals and people from media who are present here today. Our focus has always been very clear. How do we deliver world-class, high-quality healthcare to more and more patients across the country? As healthcare providers, we recognize that the challenge before us is not only in growing the burden of diseases, but also ensuring timely access, clinical excellence, and consistency of outcomes for every patient, irrespective of where they seek it. Orthopedics is clearly one of those specialties that has witnessed tremendous advancements over the years, from minimally invasive procedures, robotic-associated procedures, to advanced implants and precision-driven techniques. The field has evolved significantly. These innovations are transforming recovery outcomes, mobility, quality of life for patients. However, while technology has progressed rapidly, equitable access to advanced orthopedic care and standardized clinical practices remain a challenge across many parts of our country. This is precisely where collaborations like the one we are announcing today become extremely meaningful. Healthcare advancement today cannot happen in silos. And
back when Mr. Soy, you were taking a lecture, you took a speech and to motivate us. In that, it was everything to be all around patient and to bring in quality, to bring in whatever is good happening all across the world should be available at Max for the patient, whether it is the technology, whatever it is. And why are we here? When we hear all of this, it's because we in India, we have a lot of arthritis and only 10% of those patients who have actually arthritis get the benefit of this arthritis. Arthritis is one of the most common debilitating disease that is happening in India. Every day, all around, if we all see our relatives, someone who is very close to us walks with a bent or a crooked knee, a pain in the knee and the knee arthritis. COVID has introduced to us all that about avascular necrosis and hip arthritis, and suddenly everybody knows about hip arthritis. Then fractures, management of those things, all of this led to hip arthritis and knee arthritis all across. So we want this group, a subset of patients, to get benefit. Then when you talk of them getting a benefit, whenever you talk of replacement surgeries, the problem that was that all these replacement surgeries were happening with conventional means. Now replacement surgery is very common. You might say that it is very common. Every tier 2 and tier 3 city is also delivering. But then what is happening is that around 20% dissatisfaction rate is also well proven now. So that means if out of 100 patients, 80% feel comfortable after this surgery, there is those 20